Simone, we know each other really well and we have done for a lot of years, but for the benefit of everybody else out there who doesn't know us, I'm Susan Priivald. I'm the Executive District Director for the North Coast, which is Northern New South Wales, Mid-North Coast, and at the moment for Taree CC.
And as you said, we know each other and have done for a long time, but my name is Simone Czech and I'm the Executive Director of Child and Family in Commissioning, so I work in our head office.
I'm interested in knowing what's new about case management.
One of the major changes is historically we've focused on children's placements in out-of-home care. Now it's a much broader continuum, so the new case management policy looks at everything from preservation through to aftercare. So we're incorporating all parts of the work that we do, both in FACS and with our non-government partners.
In terms of what the field needs to think about in FACS, what's FACS's role in that, Simone?
So FACS still has a statutory responsibility to children and young people, either who are reported at risk of significant harm or who we've got parental responsibility to the Minister for. I've had young people say to me being adopted made the world of difference because I knew a caseworker wasn't going to come and move me to my next placement. I knew that couldn't happen. So I think sometimes we've got to really think about what permanency means from the child's point of view, and well, not sometimes, always,
right.
and really hone in on that, and that will guide caseworkers to the best permanency option. So what that means is we're still responsible for investigating risk of significant harm reports when we receive them, and we have a monitoring role for children when they're placed in the out-of-home care sector to make sure that NGOs are doing the things that we've commissioned or asked them to do. And that ask is actually about what is the permanency goal for children and young people.
Traditionally, we've had case management transfer of kids in parental responsibility to an out-of-home care NGO. Is that still the case under this framework?
It is. So when children are placed with a non-government organisation, case management is transferred to an organisation in most cases. The difference now is that from the beginning we need to be involved in what's the permanency goal or determining the permanency goal for children and young people in out-of-home care, and also if that changes, FACS needs to approve that and work in consultation or collaboration with the NGO to make sure that that is the right permanency goal for children and young people.
Simone, when we talk about permanency, what is it that we're actually talking about for kids and families?
So permanency can mean everything from preservation, so kids remaining safely at home, and if there's a risk, with some additional supports to mitigate that risk. But it can also mean permanency by a court order, so guardianship, where there might be a relative or a kinship carer that can look after children and they don't need to be in state care. It might mean adoption, open adoption, where again children are unable to be returned home safely or restored safely to their birth family, or there's no relative or kinship carer available. So adoption is in the best interests of children and young people in that case. And there's lots of research that tells us that stability for children and young people is incredibly important, and particularly related to adoption where, like I said, they can't go home or there's no family that can care for them. The continuum of care that we're asking our NGOs to provide now is much broader than we've ever asked them before. So if you think about prior to October 2017, we very much asked NGOs to deliver an out-of-home care placement service. So what we're asking them to do now is actually provide preservation services. So an example might be where children are at risk of entering out-of-home care, but we think, look, if we provide some additional support to the family and the NGO can provide that, we might give them a preservation package and that child is able to stay at home safely with some additional support.
What lengths of time would an NGO be able to be engaged, say, in a preservation space to work with families?
FACT still has a statutory responsibility to deliver child protection services. That said, where we decide that is the absolutely right thing to do for that child and the family, then they can be up to 2 years. So there's a 2-year period in which we can deliver those services. What's important to note about that is 2 years is a long time in a child's life. There's review periods that are in place and set down in contracts that we actually need to monitor against. And that's where our permanency coordinator staff come into play, where they can help NGOs and our other staff, like contract managers, make sure that we're doing the things we need to for children and their families.
Are we going to only rely on those NGOs that might have traditionally provided an out-of-home care service, or agencies we might have traditionally funded through some form of program arrangement? Or is it likely that we'll rely on a broader suite of services from this point forward?
Our staff currently have a plethora of options that they can use. So some examples are intensive family-based services, now multi-systemic therapy, functioning family therapy, so brighter futures, so helping our staff understand referral pathways, again where the permanency coordinator can provide some support, and making sure that families get the right service at the right time to protect children.
Restoration is a permanency option for kids. From personal experience, I think one of the things that traditionally we haven't done as well as what we could as an agency is to restore children. What will we experience differently around the prospect of restoring children to family, kin, and in some instances country?
Yeah. Having a support system to actually support the restoration, both in the planning stage, when it's actually happening, and then after children go home. So what we've done as part of the permanency support program, and you'll see in the case management policy, is a package that's a restoration package. Now, what that means is there's some additional funding that we provide to an NGO who can actually provide some additional services. So they might provide the service themselves, but they can also contract it out to some other agency who might be able to provide that service. The other thing I should have said about the restoration package is when children go home, the funding continues for a period of up to 6 months. So it's not like the minute children go home, we go, all the best and good luck with things. There's some additional services that are required to be provided to make sure that that arrangement is sustained and children don't come back into out-of-home care. There's also some flexibility, and again, this is where the permanency coordinator comes into play, to extend it past that period if there was a need to do, if the family had a need for that to happen.
We are moving more towards an engagement framework with families, and presumably if we're looking at issues like preservation, it assumes that we are working much more closely with a family around engagement, because being in a family's life for up to 2 years in an attempt to avoid a care entry is actually quite a different framework than where we might previously have come from. So what's the role of families in this arrangement?
There's certainly a role of families being involved in every decision that happens for a child, or their children, and making sure that they're involved in things like family group conferencing, planning meetings, case conferences, have a say in what services are engaged to address a particular need that's been identified, so risk, and being open and transparent about that so that we do get the right services in place. The other thing I'd say, which is important for our staff, is that we operate within the practice framework, and things like dignity-driven casework and using some of the tools that we've got at our disposal to engage families in a respectful and meaningful way.
So it sounds like a lot is the same in the arrangements, though we're labelling it as permanency support. Am I correct in my thinking that some things are the same?
What I would say is that one of the significant changes we've made, and I'd argue a number of caseworkers were already doing this and are doing this, is being very clear from the minute a child, for example, comes into care or comes to our attention, that we're clear about, well, what is the permanency goal for that child or that family? And, you know, remembering it's everything from preservation through to aftercare and open adoption. So thinking about that early, and then the packages are for a period of up to 2 years. All of the packages are up to 2 years. So we want for children, because we know when you look at attachment and bonding and other research that children can't wait for a decision about their particular circumstances.
Sure. It's how do health and education or justice actually contribute to permanent outcomes for kids, because that's what we're interested in.
Yeah, education is a good example where children have an absolute human right to receive an education and be engaged in school regardless of how old they are. And, you know, a really crude example is if children are excluded or expelled from school, the likelihood of, for example, finding an adoptive parent, if that was a child's permanency goal, is probably, you know, it's unlikely that you're going to find someone who's willing to take on a child who isn't engaged in school. Same with health. Like, children deserve to be healthy and get the things they need to address any issues.
So we really need to also make specific mention of Aboriginal kids and young people in the permanency arrangements. We know that there is an absolute over-representation of Aboriginal kids despite everybody's efforts to avoid Aboriginal kids entering care. You know, we're not on the winning stakes there in terms of great stats. So what additional supports and services or packages are available for children and families if those people are Aboriginal?
The proportion of children who are Aboriginal in out-of-home care continues to increase. So another thing we knew is that if you're an Aboriginal child, in terms of exiting somewhere, you're more likely than non-Aboriginal children to remain in care. So you're less likely to be restored. You're less likely to be subject to a guardianship order. So one of the things we've done to try and start to address the overrepresentation of Aboriginal children in out-of-home care is introduced an Aboriginal care package. So it has a higher amount of funding allocated to it, and that's really to start to try and address some of the cultural needs of children and young people who are Aboriginal. We've also introduced a cultural care package, which again is in recognition that Aboriginal children have some additional needs from a cultural and spiritual identity point of view that means additional services or casework has to happen to make sure that we're meeting their needs. So we do want Aboriginal children being cared for by Aboriginal people, and we also want, where we can, Aboriginal organisations looking after Aboriginal children across the permanency continuum.
The other thing that the permanency support packages recognise is that sibling groups of 4 or more kids, or kids that perhaps have some form of additional need, that there are additional supports because there's more work when you've got a sibling group, or there's more to think about, because we've got, if there's a sibling group of 4, for example, we've got 4 individuals, not a collective. We've got 4 individuals and a collective, but often, you know, different kids need quite different things. So there is a sibling package as well.
There is a sibling package. So like you said, it's for at least minimum of 4 siblings, which some people might think, well, what about the sibling groups of 3? Or
sure.
And the reason we went with 4 was because when we looked at the data that we had about sibling groups, is that there are a lot of sibling groups of 3 that are already together and managing quite well within the existing program. Where we started to see some really some problems, particularly where there might have been opportunities to put siblings together, but carers just didn't have the means to do it, or agencies for that matter, it was the 4 or more. So again, it's an additional package that you might be able to purchase some additional support. That's where the permanency coordinator can help caseworkers, so to make sure that children are getting the packages that they need.
Simone, so really what you're saying is that from the very first point of contact that kids and families have with FACS, from the very first report actually, we should start thinking about permanency options, including keeping kids at home, or for those kids who currently might be sitting with triage teams or in an ongoing child protection team, and for those kids in care, that's great. We can get caseworkers and managers to start thinking and planning around permanency. But the reality is we need the dollars to flow. We need to be able to buy the package to keep a kid at home through in-home support or whatever it might look like.
Some of it's kicked in already. So on the 1st of October last year, we moved all of our NGOs who provide permanency support across to new contracts. So the new contracts included all of the things we've described today that are within the permanency continuum, except for the preservation packages at the moment. Now, the reason for that was because we needed to do some more work about how does that new package fit into all of the other services that caseworkers have at their disposal, and being clear and providing some advice to or information to caseworkers so they know which ones to go to.
What is a permanency coordinator? They're pretty new. They started to come on board from about November, but really, what's their main role?
The permanency coordinators, I think, are incredibly exciting, and it's the first time that we've had positions first time we've had positions that can focus on providing support, and I'll talk about that support in a second, not just to our caseworkers, but NGO caseworkers as well. So that's the first thing that's important. They're not just a resource for facts.
Yep.
In the spirit of collaboration and working together in partnership with our permanency support providers, that they are also a resource for the NGO sector. So there are 50 permanency coordinators across the state. So they're allocated to districts. So
Yep.
they sit in each of our districts, and depending on the size and volume of work in each district will mean how many you have. So some will have more than others. But their role is very much about the coordination of packages and services and making sure children do have a permanency goal in place within the required timeframes. One of the things they will not do is case management. And I think it's really important to be clear about that, because it's either our caseworker or the non-government organisation caseworker that delivers case management and does the case work. Each of the permanency coordinators are expected to have a very good understanding of the service system in their respective district. So if a caseworker was a little bit unclear about where they could refer a family to, my expectation is that they can ring the permanency coordinator, and the permanency coordinator will be able to give some advice.
So it really sounds like, given a bit of time, that we'll have less kids entering care because we'll be able to preserve them at home or in other family arrangements that keep kids safe through a range of support for up to 2 years. We'll have a range of kids who are currently in the care system exit to more permanent arrangements through either guardianship or adoption, whatever's most appropriate to the kids. So conceivably, we'll have less kids entering care and we'll have more kids exiting care. And I think that's really part of the agenda around the permanency arrangements too, isn't it?
It is, absolutely. There's 3 objectives of the permanency reform. So the first one is less kids entering out-of-home care.
Yep.
So living safely with their family, whether that be birth parent or relatives or kin. Increase exits. So when we talk about exits, they're things like guardianship, as you mentioned, adoption, restoration in particular. So an absolute focus on that. But we also don't want that to happen because we've got that objective. We want that to happen because it's in children's best interest. So there shouldn't be any decisions made because of the objective of the reform purely. It has to be about what children need.
It's always about what kids need.
Yeah. So, and look, there will always be kids in out-of-home care. Because that's the best place for them. The third objective of the reform is for those kids that do need to stay in out-of-home care, is that we make that the best possible experience we can for them. So there's some work to do there, particularly with the children's guardian and supporting both the delivery of our out-of-home care services within FACS, but also the NGO sector to make sure that we are absolutely delivering the best service we can for children.
So Simone, it's been really good to talk today. I think it's a great way of just trying to get some information to the field that they need. I appreciate that you made the time to have a bit of a chat about the permanency support program.
Absolute pleasure, Susan, and I hope we get a chance to do this again and do more of these little videos that hopefully will help the field.
A series?
Yeah, series
Oh,
maybe.
look out.
We'll be actors before we know it.
Not quite sure.